Welcome back to Training Muscle Lengths, Part 9, Delts. The deltoid has 3 heads, all 3 of which insert into the humerus. The anterior or front delt originates at the clavicle, sometimes people call it the clavicular head. The middle delt originates on the acromion process, people sometimes call it the acromial head. And the posterior or rear delt originates at the spine of the scapula, people sometimes call it the spinal head. Unlike the other single joint muscles we've talked about where multiple heads essentially have the same function, there's an absurd amount of motion at the shoulder joint, and so each of the heads have distinct functions. The front delt performs flexion, abduction, and horizontal adduction. It also does medial rotation, but it's not a prime mover. You've probably heard people say that the front delt gets enough work from pressing. That's because essentially every pressing movement has some sort of flexion and or horizontal adduction going on. Its fully lengthened position is achieved in the bottom of most pressing motion, especially when the arm is closer to the body in the scapular plane. Speaking of, quick note on planes, technically there's only 3 actual planes when we talk about movement. We have the frontal, the sagittal, and the transverse or horizontal. When someone talks about a scapular plane, they're essentially talking about 30 degrees-ish forward of frontal, which is generally the angle of the scapula when it's fully relaxed, and allows for the greatest range of motion at the shoulder joint. I'm sure someone's going to try and jump my ass because there's more to it than that, but we're just going for a super simple quick explanation here. So remember we said front delt, lengthened position, bottom of a press, and shortened position is when we start getting overhead. If you remember from our scapular video, the scapular upward rotation is responsible for the final little bit of overhead motion, so the front delt will reach its shortened position before your elbows are all the way up by your ears. Alright, middle delt, super easy, only function is abduction. Fully lengthened is going to be fully adducted. In theory, if we just chopped all this away from you and just had your shoulder joint, we may be able to get more of a lengthened position because your torso obviously gets in the way. So you'll see people hinge at the hips ever so slightly and bring that arm just in front to try and get a little bit more range of motion. Is it actually being more lengthened? Hard to say, but for the record, I do it too. So if adducted all the way is fully lengthened, abducted all the way is fully shortened. We'll talk about the best possible movements to train each position in a different series. Main goal here is just covering the muscle length themselves. Rear delt we have extension and of course hyperextension. Abduction, just like how the front delt also assists. Horizontal abduction, that's the big one. And lateral rotation, although it's not a prime mover. Rear delt lengthened position is fully horizontally adducted, and ideally we'd have a little bit more flexion here. So his arm would be a little bit more like this, and fully shortened when it's horizontally abducted, with the arm just a hair below the shoulder. Long at the bottom of a press, short when it's overhead. Long when it's at your side, short when it's abducted about 135 degrees. Long when it's horizontally adducted, short when it's abducted. Comment what muscle next.